1. Mechanism and application. A 58-year-old woman with newly diagnosed diffuse large B-cell lymphoma is started on a chemotherapy regimen that includes prednisone. What is the primary mechanism by which glucocorticoids exert their immunosuppressive and anti-inflammatory effects? A. Inhibition of cyclooxygenase 2, COX-2. B. Inhibition of dihydrofolate reductase. C. Inhibition of NF-κB and cytokine transcription. D. Blocking of purine synthesis via inosine monophosphate dehydrogenase. E. Antagonism of TNF-R receptor. Correct answer C. Inhibition of NF-κB and cytokine transcription. Glucocorticoids inhibit NF-κB, a key transcription factor in cytokine production, suppressing both B and T cell function. This contributes to their broad immunosuppressive and anti-inflammatory properties. Why not the others? A. COX-2 inhibition. This is the mechanism of NSAIDs like celecoxib. B. Dihydrofolate reductase inhibition, seen with methotrexate. D. Inosine monophosphate dehydrogenase inhibition, mechanism of mycophenolate mofetil. E. TNF-R receptor antagonism, seen with etanercept, not glucocorticoids. Question 2. Adverse effects and withdrawal. A 45-year-old man with severe asthma has been using high-dose prednisone daily for 6 months. He suddenly stops taking the medication. 2 days later, he presents with profound fatigue, hypotension, nausea, and abdominal pain. Lab results show hyponatremia and hyperkalemia. What is the most likely cause of his current condition? A. Acute adrenal crisis due to suppression of hypothalamic pituitary adrenal HPA axis B. Electrolyte imbalance caused by mineralocorticoid receptor blockade. C. Drug-induced primary adrenal insufficiency. D. Drug-induced syndrome of inappropriate antidiuretic hormone secretion, SIAD8. E. Adrenal hemorrhage due to coagulopathy. Correct answer A. Acute adrenal crisis due to suppression of hypothalamic pituitary adrenal HPA axis. Chronic glucocorticoid use suppresses the HPA axis. Abrupt discontinuation after prolonged use, acute adrenal insufficiency, which can be life-threateners. B. Mineralocorticoid receptor blockade, more typical of spironolactone or eplerenone, not glucocorticoids. C. Primary adrenal insufficiency would be caused by autoimmune disease or adrenal destruction, not exogenous steroids. D. Would cause hyponatremia, but not hyperkalemia or hypotension. E. Adrenal hemorrhage, seen in Waterhouse-Friderichsen syndrome, typically due to sepsis, not steroid withdrawal. Would you like